This is How to Treat a Skin Cancer Patient by Katherine Baker. Hello, Lauren. My name is Katherine Baker. Nice to meet you. I hope you're doing well today. I will be taking care of you and assisting with any concerns that you might have, okay? Recently, your dermatologist took a tissue sample of a spot that you had presented on your face, correct? And today we will be discussing the results of your biopsy and the plan of treatment. So your pathology did test positive for a skin cancer cells specified as basal cell carcinomas, or BCCs. And this is that lesion that you were initially concerned about. And again, thank you for coming in so that we can take care of this as soon as possible. So basal cell carcinomas are skin cancer cells on the outermost layer of the dermis, your skin, and they're caused mostly by sun exposure, and you can also get them from tanning beds. BCCs are the most frequent form of found cancers, but are unlikely to spread from its original site. The procedure that I would like to talk to you about, Mohs surgery, is a highly effective, easy, one visit outpatient procedure. So the surgeon that will be performing your procedure will be Dr. Jennifer Perrone. She has had a fellowship at, in Mohs surgery at the University of Texas Southwestern, and later went on to become faculty to be able to teach Mohs surgery. So she's highly qualified, very experienced. The procedure will go as follows. Upon being called back, we will examine the site and mark the parameters around the lesion, or mark the margins. We then will inject a local anesthesia to numb the site. And once using the scalpel, Dr. Perrone will remove a single layer of tissue. The extraction will be examined under a microscope in an on-site lab where you will receive immediate results. If cancer cells remain, the process will be repeated. We will go through the surgical process as few times as possible so that we can try to spare as much healthy tissue as we can. Typically, the procedure can take 1 to 3 hours. If the lesion requires multiple extractions, the length of your time in the clinic will increase. If cancer cells are no longer present, Dr. Perrone will stitch the site, and once the anesthesia wears off, you're free to go. You are more than welcome to bring a guest for company and transportation home, although not necessary. We ask that you refrain from smoking or consumption of alcohol for 24 to 48 hours prior to operation. A nurse, most likely I, will bandage the site when Dr. Perrone is finished. You will leave this dressing on for 24 to 48 hours. Please try to avoid getting it wet. When you arrive home, you may ice the area for 15 minutes and continue that once every hour. 15 minutes every hour if you'd like. This will help alleviate the swelling and the tenderness of the wound. The following day after surgery, you may ice every 3 to 4 hours if you feel necessary. For wound care, and listen closely, you will remove the bandage before showering. Wash the wound with soap and water only. And this will remove the drainage or the crust, is what you're washing this wound for. Apply Vaseline or Aquaphor and cover with Telfa dressing, which we will supply you with some, and tape. So just tape it around the lesion before or after you get out of the shower. And you'll repeat this until your follow-up visit. If the wound is not properly taken care of, an infection could form, and taking the care of the wound as we recommend it It will obviously prevent some infections and also help prevent scarring, which I know you don't want a scar on your beautiful face. We appreciate you coming in, Miss McShin, and we look forward to seeing you for the follow-up visit. And we will remove your stitches in 2 weeks, okay? And Linda at the checkout desk will help you schedule your follow-up visit, your follow-up appointment, and to make sure that the wound is healing well. Okay, thank you and have a great day.